This was a concept that started in 2022. The Prince William County Board of Supervisors provided a directive in 2022, and by 2025, we're going to have this facility open.
So the process for me was to really talk to, investigate, and discuss the needs in the county. And when I did that, what came out of that were 93 stakeholders that believed in having a crisis receiving center, a mental health care center here in Prince William County, as well as our public safety employees. They needed a place where when they go and pick up someone that has an episode, or when there's someone in the community that's having an episode, there needs to be a place where the person can go and get help. And so the 93 stakeholders, our public safety community, as well as our state and federal delegation, really believed in Prince William County having a crisis receiving center.
One of the things that we were hearing after chatting with, I think, over 300 individuals was just how much mental health was part of our criminal justice system, and how many people who are experiencing struggles with mental health were actually caught up in our criminal justice system. And so we were hearing that we needed to find better mental health care.
Before the pandemic here in Prince William, we had mental health challenges that were staggering. Since the pandemic, that's only become exponentially more challenging. So I couldn't be more grateful to be a part of the conversation, to be a part of the efforts, mostly behind the scenes, to help to support this. And I really look forward to seeing a very amazingly vibrant and heavily utilized crisis receiving center.
Well, it's going to be a center when a person is having an episode, and they can be there 48 to 72 hours. It'll have 16 adult beds and 16 recliners, 8 youth beds and 8 recliners. It'll also have wraparound services in the building. So once we've stabilized the person, what does it look like when they have pharmaceutical needs, when they have housing needs, when they have financial assistance needs? What does that look like? And so those are the type of services that we will offer in the Crisis Receiving Center.
We are so excited for this Crisis Receiving Center. It will be the first of its kind in the state, and something that we as law enforcement have never seen before or unfamiliar with. And so I had the opportunity to go out and tour 2 locations in Arizona that we're mimicking our program after. And I've been able to come back and share with people how amazing this place is going to be.
When we directed our county staff to look for a partner to facilitate this building, we told them, hey, don't just look at Virginia, look at the entire country, find the top rate folks that do this and bring it to Virginia. So we actually are the first in Virginia to bring connections to the state in order to facilitate this.
You know, what's exciting about the Woodbridge facility is it really kind of supercharges everything we've been doing at Connections. So we like to co-locate all our services, our urgent care, 24-hour OBS, long-term beds. So regardless of who you are, it's one-stop shop. And now we've taken this even a step further, because this facility will have our crisis services for adults and youth, plus outpatient services from the Community Services Board. So they're going to have their youth outpatient service co-located, their trauma program, a few others. And so it's going to be even more of the continuum of care under one roof.
This facility is made up of 3 different distinct sections. One is community services, where we're going to be moving services from elsewhere in the eastern side of the Prince William County to this center. And so community services is having a door that is built, and you're going to be able to access services there if you have an appointment, if you have a group, if you need peer services. So that's going to be on the right-hand side.
I'm very grateful to Prince William County that when they conceived of Woodbridge, they said, not only do we need a crisis provider, but we need to put our other outpatient behavioral health services here too. And I think that's just going to make for such a seamless experience for so many served there, where when you're discharged from Connections, if you need to connect with Prince William County CSB, you're just walking over in the facility. It's all right there. And I think that is just so powerful and just speaks so much to just a seamless patient experience that gets me excited.
The central part of this is going to be the Crisis Receiving Center, and that takes up most of the square footage. The Crisis Receiving Center will be run by Connections Health Solutions, and they're going to be providing those crisis services. What you see on the front of the building is the Crisis Receiving Center. So doors will be there for individuals as well as family members to drop off those in crisis. So that is somebody checking themselves in for crisis services.
It's going to have the adult and youth component. Again, there's no wrong door. It allows people either through law enforcement, through court, or through just individual families or individual cells to actually come in to receive the treatment that they need. No rejections. Law enforcement can do what we call a soft handoff, and so it allows them to bring the person there so we can alleviate and allow emergency rooms to be for true medical emergencies, jails to be for things that really are for jails, and mental health is not where we want most of our neighbors to be because they haven't really committed crimes that should put them in jail. What they have is a mental health moment.
We had an incident experience a number of years ago in which we had to wait in desperation after her son had been arrested, actually. And we were still trying to get mental health care. Even though he'd been arrested, we still couldn't get him care. And we finally found a doctor who would take him. His situation was complicated because he not only has bipolar disorder, but co-occurring substance abuse issues. And at that time, most, for example, the hospital, Prince William Hospital in Manassas, would not treat anyone with a mental health condition who had co-occurring substance abuse issues unless they had been substance free for 6 months. So the hospitals turned us away. And I finally found a doctor up in Arlington who was willing to see him, but it took 6 months to get an appointment. So we were just on tenterhooks trying to keep our son out of the criminal justice system and out of total breakdown, a crisis for 6 months, and we were not successful. It was a horrible, horrible time. So this crisis receiving center means that my family, in that crisis mode back in 2010, we would have been able to take our son directly to a crisis receiving center and they would see him right away. We would not be turned away. It would be an open door. It would be life-changing for families like ours. And I know that we are not the only ones because I hear from people all the time.
We're sitting with these individuals in a process that really law enforcement, we try really hard to be out of, right? This is mental health. It's not criminal. And we've been kind of forced to be in this position and through the laws and everything. So when the Crisis Receiving Center opens up, that's the place for these individuals to go. We bring them there and they're immediately receiving care.
The alleyway to the left is the law enforcement side, as well as the fire and rescue side. We may have ambulances dropping off clients. With that law enforcement side, they're going to be able to have exclusive access to bring somebody in crisis directly into the crisis receiving center.
I can't wait for it. It's going to be so helpful for our community. But for law enforcement, it takes us out of the process. And so we don't have to sit there and watch these individuals suffering for days or sometimes weeks. We get them to the facility and drop them there less than 10 minutes, and we're out and we're back on the street handling criminal calls for service rather than persons in crisis.
One of the areas that I really wanted to focus on too was not only the youth, but the fact that right now, because we don't have one yet, and it's coming up and running, is that if someone has a mental health crisis, especially if they're a child, they have to be transported not only out of the area, but sometimes out of the region. You have sometimes law enforcement or people's families having to transport, especially children, to Williamsburg, to other parts of the state, sometimes out of state. And if you think about how heartbreaking it can be for a parent who has a child who's going through a mental health crisis, not only is their child going through that, but suddenly their child is being sent to Williamsburg or Southside or even another state for treatment, and having that separation, when some folks feel like that's the time where these kids need their families the most. I've been a big supporter of making sure that as much as we can, that youth component of that crisis receiving center is robust and it continues to expand over time.
The third and a very important part of this is community response area. So those are the staff that will provide co-responder services, attending out to calls for service with our law enforcement partners to see if we can help mitigate situations in the community, as well as provide discharge planning for those that are either being released from the crisis receiving center, a state mental hospital, or simply need additional supports here in the community. On the backside, behind the crisis receiving center, is where the community response area is going to be. Co-responders, discharge planners, the hearing room for temporary detention orders, as well as emergency custody orders. That's where the hearings will be held with the special magistrate.
All across our county, we have people who have mental health issues, and to have a place where they're able to go and get the necessary help that they need. And especially for our military members, me being a military veteran, and I'm also a veterans commissioner for our county. And so that's significant for us, because now we know that veterans and our residents will be able to go someplace where they can get the necessary help that they need to continue to live a normal life.
Anyone coming to us, just come. If you're not suitable for our services, for example, you're in a physical health crisis or something else, we'll help you get to where you need to go. We never turn law enforcement away. We don't turn folks away at the door. We don't put up barriers to treatment. So that's key.
Do you think the county is ahead of the curve?
Absolutely. Absolutely. That's a wonderful question. And I will tell you, I got a compliment the other day from one of my colleagues, Chair Phyllis Randall, who used to work in mental health in the county. And she said Prince William County has the best level of service for mental health in the region. And I believe that.
There's so much need out there that while we may be the first to open one of this kind, we're certainly not going to be the last. And we're happy to help our community partners, our greater community here in Virginia, build a similar type of situation where they can serve clients just like we will be able to serve clients in 2025.